Visible?
Yes, sir.
Yeah, let's move on. Yeah, so everybody please pay attention. Question number 1, a study on 200 preterm infant is carried out with a power of 80%. The odds ratio of caffeine in decreasing symptomatic apnea is reported as 0.76, that is confidence interval of 0.65 to 0.87, 95% confidence interval. So true statement about this finding is, you can write your answer A, B, C, D, E. The odds of developing apnea on caffeine is 24%. The odds of remaining apnea free is 76%. The change to alpha error is high. Sample size should be increased to 400 infant, and caffeine is effective in reducing apnea. So which one of these statement is correct? So a lot of them, they have given answer E. Some of them have given A, E. All right. So I think a lot of you have given the correct answer, and the correct answer is E. And here basically it is risk reduction and not the odds ratio. It's odds ratio is like basically reduction in this. So correct answer is answer E. Basically, caffeine is effective in reducing apnea, and that is the correct answer. Now coming to the next question. The above graph represents serum glucose values in neonates at 4 to 6 hours of birth. The mean is 60 milligram deciliter and standard deviation is 10. True statement about this distribution is 34% neonates have glucose more than 70. 68% of neonates have glucose between 60 to 70. 5% neonates have glucose more than 90. 99% of the neonates have glucose between 30 to 90. So this is bell-shaped curve with a standard deviation of 10 and mean of 60. No answers? Yeah, there are answers. Okay. So B, D, D, B, D. So everybody please think and answer so that and those who whose answers are wrong, please again you can go back and read. All right, so the correct answer is D. That is 99% neonates will have blood sugar between 30 to 90. And why so? Because the standard deviation is 10 and mean is 60. So 3 standard deviation is equal to 99%. And 3 standard deviation on either side is 30 to 90. So easy to understand. But I think many of you have given the correct answer. All right, so let's move on to the next question. So this is last question in the statistics, so don't get worried. So true statement about the graph is, so this is the graph where mode, median and mean is written. The data is skewed to left. So which is the true statement? The data is skewed to the left. Mean should not be used as measure of central tendency. Mode should be used as a measure of central tendency. Median should be used as a measure of central tendency, or none of the above. Kindly answer. So D, then any answer more? D, the only one. A, D. Then A, D, D, C, D. Okay. So a lot of people have given answer A, a lot of people have given answer D, some of them have given answer, I think C also I saw, I think. All right. So again, the previous question we saw was a bell-shaped curve, and their mean mode median was same, and therefore it was a different distribution of population. Now here we have a population which is not bell-shaped or which is skewed. Now the data, so the answer, correct answer to this is answer D. Median should be used as a measure of central tendency. The A is wrong because the data is skewed to the right, not to the left. And the mean mode should not be used, median should be used. So the correct answer is D. All right, when the data is skewed, you have to use median. Now coming to question number 4. Syndrome of inappropriate antidiuretic hormone secretion is characterized by all except low urine output, low sodium excretion, high urine osmolality, low plasma osmolality, and weight gain. So which of these is kind of wrong? So 2 people have written E. A, D, I think we got all the answer here, all the answers. So none of it's not. I think it's. It means that the question was reasonably good for you all to think, and because there is everything from A to E, some of them have given correct answer. So very few people have given correct answer. The correct answer is low sodium excretion, that is B. Because syndrome of inappropriate SIDH basically causes more of water retention. So sodium excretion is not affected. There is water logging in the body. The kidneys, they will retain more of water, and low sodium excretion is not seen in SIDH. Now next question, which one of the following is the most important risk factor in the etiology of intraventricular hemorrhage? So these are all the etiologies. So one of which is the most important risk factor? Coagulation disorder, invasive ventilation, pneumothorax, extreme prematurity, and hypoxic ischemic encephalopathy. So which of them is most important risk factor? So I think D. I think it's thumping D. Everybody is D. So I think everybody is very sure. And yes, I think you're all right. D is the correct answer. Extreme prematurity is the biggest risk factor for developing intraventricular hemorrhage. So we know that there is coagulation problem. We know that these babies are ventilated, so on and so forth. But we have to remember extreme prematurity is the biggest risk factor for developing intraventricular hemorrhage. Let's go to the question 6. Which one of the following? Oh, I'm sorry. Oh, yeah. Which of the following malformation occurs earliest in the development of the embryo? So, development of the fetus or embryo: cleft lip, omphalocele, anencephaly, hypospadiasis, or syndactyly. Which one of them is the earliest to happen in the fetus? C, C, B, C, C. I think here majority have written answer C. So yes, C is the correct answer. It is anencephaly. So the neural folds is the first one to close, and anterior neural pore, if it doesn't close, then what is there is anencephaly. So embryologically, this is something which is very, very early in gestation, as early as I think 3rd week or so. So anencephaly happens very much early in the gestation if there is anything to go wrong. Let's go to the next question. Now, there are 2 more questions, so then we are done. I think we have time. We are supposed to conduct at 2-3 minutes other, so we'll finish in time. True statement about hemoglobin oxygen binding in neonates is it is energy independent. Acidosis increases binding. Chronic blood transfusions increase binding. High altitude increases binding, and hypothermia decreases binding. So, which is the true statement? So we have only one answer so far. E, D, E, E, D, D. So actually, yeah, so I think it's majority D and E. I think here also we got all the different answers, but I'm surprised that not a single correct answer. See, basically, acidosis increases binding, no, it decreases binding. Chronic blood transfusion, because there is adult hemoglobin, so it decreases binding. High altitude decreases binding. Hypothermia increases binding. So the correct answer is it is energy independent. So basically A is the correct answer. All right. So I think none of you got correct answer. I think Dr. Shahbaz answered it late, so he doesn't get a point. So I think not a single correct answer for this particular question. All right. So let's move on to the next question. So symmetric IUGR differs from asymmetric IUGR. Which one of the following is not a characteristic of the symmetric IUGR, which is not there in symmetric IUGR? So please pay attention. So normal ponderal index, lower head circumference, high risk of hypoglycemia, low risk of asphyxia, and delayed catch-up growth. So which one of them is not a characteristic of symmetric IUGR? Oh, I'm sorry. I think by mistake. So high risk of hypoglycemia is not a characteristic because it is not growth restricted neonate. It is a neonate which is symmetrically small. So that risk of hypoglycemia is not as much for symmetrically small. I think by mistake it came. I move to the next slide. All right. This is the last question. So what is the problem seen here in the head ultrasound? You can write the problem and then we will discuss the next question. Do you see any problem in this head ultrasound? You can type. PVL, flare, IVH, PVL with hydrocephalus, flare, PVL, dilated ventricles, PVL, PVL, normal. All right. So basically what you can see here is a periventricular white matter echogenicity. So this is qualifying as a PVL because there is slight ventricular dilatation also. So this is a basically PVL. All right. And so the most likely cause for the finding displayed is, so which one of them is most likely cause amongst the abnormalities which are mentioned? High alveolar O2, low plasma carbon dioxide, low white cell count, high hemoglobin, and low hematocrit. So which one of them is most likely to cause this particular problem in the baby? It's a low hemoglobin. Sorry. So it's a low plasma CO2. I think a lot of you have answered correctly. So I think this with this we come to the end of this particular session. Anyone has got any comments, anything to tell? Dr. Kavita, should we call it a day?
Yes, sir. If they have any questions, they can briefly put up, but I think we can. So thank you so much, Dr. Tushar. I think good case presentation and a lot of MCQs, so we learned so many things. And thank you so much.
Thank you so much. Thank you, Dr. Kavita. Thank you, everyone. Good night. Thank you.
Good night. So good night, all the students. We'll see you next Wednesday then.
Yeah.
Thank you so much.